Good afternoon. Welcome, everyone. Nice to see you. Very happy today to have come off a beautiful weekend here in Central Illinois where I think I saw a lot of people doing the right things regarding sheltering in place. We'll talk about that some. In addition to Monica Hendrickson with her report today, we'll have Kate Green, who's the Executive Director for Home for All, a continuum of care project with the Heart of Illinois United Way. And then, of course, we have Scott Sorrell present in the building, too, if you have any questions for our county administrator. I'm Andrew Rand. I'm chairman of the Peoria County Board. I'm here on behalf of Mayor Artis, Chairman Zimmerman from Tazewell County, and Chairman Krug, also from Woodford County, are part of the sort of Central Illinois 3 working together in the COVID-19 crisis of 2020. Again, want to thank the media for being here and continuing to do your level best to help inform our public. And speaking from personal experience, it was early in January of this year, I moved my mother from Florida, her name is Eileen Rand, to Central Illinois, and she has been in a memory care facility since pretty much the middle of January. And I can tell you, just like everyone else who's missing a loved one, I miss my mom. Since the sheltering order took place several weeks ago, you'll recall the quarantine, if you will, of skilled care facilities and congregate care facilities for seniors. It pretty much locked their doors 2 weeks prior to that and began restricting visitation. It's hard for me not to be able to talk to my mom every day or see my mom several times a week, and I know it's hard for everyone else. We're all in this together. I stress this over and over again, and we'll all finish it together. The question is, do we want to do it fast and healthy, or do we want to do it fast and sloppy? And there's really only one course I think everyone would take. As much as I miss my mom, and I just made a turkey on over the weekend for Easter, and I just can only tell you that it really helps to take a walk with your dog, phone a friend, have a virtual meal with a friend. The personal experience I've had with some dining with friends over a phone or virtually with FaceTime has been pretty unique, but all of us have to remember to support our families and friends. And also, I very much want to acknowledge the first responders, the nurses, the doctors, the laboratory people, the folks who run samples in a car from here to a lab. Everybody that continues to work on this crisis is part of the reason we may be seeing some light at the end of the tunnel. You know, unlike some of the other super important government officials, I'll make no prognostications as to what that light means, but I can tell you we have the finest scientists in the state working on it, including our own epidemiologists. And with that, I'll introduce the Director of the Public Health Department, Monica Hendrickson. Once again, thank you for everything you're doing to help keep our public informed. Don't forget to check in with your friends and neighbors, especially if you can't talk to your own mom.
Thank you, Chairman Rand, for that reminder. Good afternoon. I'm beginning today's briefing with 2 date totals as of April 14th, are as follows. The Tri-County region has 62 cases to date. Peoria County is reporting 31 cases. Tazewell County reporting 21 cases, and Woodford County reporting 10 cases. The total number of deaths remain at 4. The hospital systems of OSF St. Francis Medical Center, Unity Point Health Methodist, Unity Point Health Pekin, and Unity Point Health Proctor report 14 ICU beds in use for either confirmed or those under investigation for COVID, as well as 25 non-ICU beds in use for either confirmed cases or those under an investigation for COVID-19. For Peoria County specifically, again, the total case number of 31 remains the same as yesterday. However, in regards to case status, there are updates. There are 11 are recovered, 16 are at home self-isolating, and 3 are currently hospitalized. I think there's a lot of questions as the governor spoke of the fact that we continue to see case numbers increase and death counts increase, but overall comparatively speaking, we are seeing that curve flattening, and a lot of that has to do with the due diligence that's being practiced as part of the stay-at-home order as well. But not everyone has the ability to stay at home and self-quarantine or isolate. To really talk about our comprehensive plan to housing, I'd like to introduce Home for All Executive Director Kate Green.
Thank you, Monica, for the opportunity to share a little bit today around the work that we're doing to address the needs of those experiencing homelessness, or maybe potentially just other housing instability issues that arise because of COVID-19. Home for All Continuum of Care is a partnership of over 50 cross-sector agencies that are working to align their efforts to end homelessness through the support of individuals and families who are seeking permanent, safe, and affordable housing. So we work to serve those who both are at risk of homelessness or who are currently experiencing homelessness in a 4-county area: Peoria, Tazewell, Woodford, and Fulton. And this work really did change drastically with the onset of COVID-19. I think for many of us, life has changed quite a bit. But in terms of the homeless individuals that are working through this right now, they are our most vulnerable, and so we have to do our due diligence to try and address those. Recent models indicate that those experiencing homelessness are twice as likely to be hospitalized, 2 to 4 times more likely to require critical care, and 2 to 3 times more likely to die than the general population. So with this statistics in mind, it becomes both an equity issue that we need to consider in terms of the outcomes that are happening across that population, as well as a resource consideration when it comes to hospital resources and community resources that have to be dedicated to those circumstances, which was all the more reason for the continuum of care to come to the table when it came to emergency planning around our COVID response. And so with that, the housing branch was stood up with the Emergency Operations Center with the idea that we need to address the housing needs that do arise because of COVID-19. And with that, we really structured our response around 3 particular populations. The first of those in need of alternate housing accommodations after discharge from the hospital. So maybe they did need to be hospitalized and did require acute care, but that phase has passed, but they can't go home for any number of reasons. Maybe there's a vulnerable family member at home, or they're returning back to a shelter facility. What is that intermediary step for them, and how can we address that need? The second is those who require isolation and quarantine but don't have effective ability to do that, again, because of their housing situation. And the third is the high-risk individual who lives in potentially a congregate living situation, such as a shelter, who, if we were able to actually move them out of that shelter situation, could reduce the potential consequences for that individual, as well as if we can deconcentrate some of the populations within our shelters, how can we increase the ability for social distancing within those locations to improve outcomes for that entire population. So the group identified that a hotel model could potentially work for all 3 of those populations, and immediately got to work identifying potential partners in our area. And so right now, today, I can say that we have executed a contract with 4 Point Sheraton for a maximum of 150 rooms to help meet these needs that we have within our community. And referrals will be made directly, so individuals will know through their healthcare professional, whether that's a primary care physician, through a hospital discharge planner, or for those individuals experiencing homelessness, they'll be working with Heartland Health Services to make that referral for them. And the expenses associated with the hotel stay will be funded by Peoria County and have been approved by reimbursement by FEMA, as well as potential for coverage through funding that was secured through the Illinois Department of Human Services, which launched an emergency lodging grant. And those funds actually were funneled down to the local continuum of care to help address the needs of those experiencing homelessness because of COVID-19. And so while the housing branch has been very focused on this work of serving our most vulnerable, the work doesn't end with just the hotel model. There's been a serious impact certainly within our shelters as well. And for many of us, kind of the shelter at home model has been a hardship. It's been challenging, I think, for most of us to make those accommodations in our day-to-day life. But for individuals who are experiencing homelessness, it really can become a question of survival because their access to the limited resources that they had before are now even more constrained. And so from frontline staff workers at the shelters who have adapted their service model to address additional cleaning procedures, personal protections, staffing capacity, and social distancing requirements, to partners across our community who have been supporting these operations, it really has been an all-hands-on-deck effort. And one of the partnerships that I'd like to highlight real quickly is the local healthcare providers that have stepped up to the plate. Heartland Health Services, OSF Healthcare, and Unity Point Methodist, all three of which have been conducting outreach to various providers and on-site assistance with staff education, resident monitoring, and much more. So in terms of high-risk individuals who are residing in our shelters, kind of that third population that I mentioned, Heartland Health Services is the one who's doing those evaluations and sending those referrals for individuals who potentially can be placed within our hotel model. And so while we're working right now to address the very near-term issues that are arising because of COVID-19, we also have our sights on mid and long-term changes or considerations that we need to be making. And so we're working with partners to identify how additional federal funds will be deployed in the ongoing COVID crisis, with the ultimate goal, of course, of moving individuals from homelessness into permanent and stable housing.
Thank you, Kate. We'll open it up to our questions. Okay. Does anybody have questions for me? That's okay. My opinion, my feelings are not being heard. Okay, go ahead.
All right, so Governor Pritzker said today that the best way that he likes to determine whether the curve is flattening or not is the doubling rate. Is that what you guys prefer here, or what is your guys' preferred method?
I think the doubling rate as a measure of how successful we are in terms of the light at the kind of end of this is really the number in which how many days does it take for our case count to really double in value. I think right now Illinois sits somewhere between 5 and 6, so it takes about 5 to 6 days for our total number of cases to be doubling. What we've seen in the past few weeks, though, is that continues to go down. We're roughly approximately, I think, is about 1,200 to as high as 1,500 cases that we've been having each day. And so we keep monitoring that because that's what we really want to see flatten out, or kind of steep, the curve of it really flatten out and make it much more noticeable that we're not really seeing that progression of virus. Having said that, the biggest indicator being that case count relies on identification of cases, which then goes back to how we do testing and the number of testing opportunities that are available. So the more testing that we see as a community, there's a good chance that we're going to see that number go up, and even that doubling rate actually maybe be every shortened, for example, maybe to 3 days. But it's still the number that we want to watch in terms of understanding the progression of the virus in our community. I'll turn it over to Kate.
Sit by, you know when these are sitting.
Hi there.
How much money has been approved by FEMA and the state for reimbursements to Peoria County?
I don't believe that we have a limit on the maximum reimbursement amount. In terms of the DHS funding that received for the emergency lodging for homelessness, that was just over $225,000 for our 4-county area.
Is the 4 Points currently online and open for this purpose as of right now?
We are very close. We are finalizing a couple of other details in terms of security and on-site case management services for individuals who are there. So I anticipate within the next couple of days we should be able to say yes to that question.
And are there any people on a wait list to get in there?
I am aware of a couple of individuals who potentially could qualify, and so they have been connected with Heartland Health Services, and we're working through that kind of evaluation process for those individuals.
And would the hotel only be used for this purpose specifically during the duration of the COVID-19 crisis?
In terms of the residents that will be staying at the hotel, I believe that the number that will be dedicated to our purposes is 150 rooms, and there is potential for the other rooms to be used by other guests during the period.
So if there's 150, have you identified maybe the projected number of people who might need to use these rooms? You said you cover 4 counties, Peoria, Towson, Woodford, Fulton. I know that you do the point in time count every year, try to figure out roughly what the population of people experiencing homelessness is. Is that believed to be enough capacity to handle, or is there potential need to be more rooms, more facilities?
I think there's probably always potential that there could be need for more. The solution with the hotel here in Peoria is actually dedicated for individuals from the Peoria city and county area. We also are working actually with other locations as well. Salvation Army Canton is covering the Fulton area, and we've been reaching out to Salvation Army Pekin as well to cover some issues in that area. So I think there's additional potential for more capacity if needed, and we'll work through that as this progresses.
And then as more people experience unemployment and economic difficulty, I mean, are we expecting to increase the homeless population and accompanying increasing need for these types of facilities?
The answer to that I definitely think is yes, and I think that you can see the federal government's anticipation for that as well with the additional funding coming through the CARES Act that will be funneled down through our community to address some of those needs. I think our goal as a continuum is helping people before they get to the point of homelessness. So more addressing issues at risk of homelessness before they're actually in the position where they need to present as a shelter. So working our best and looking at the data through both our data management platform as well as 211 information and referral line to get an idea of what the needs are and how we can get ahead of that.
So people who need this housing need to be referred by a hospital or a health center. Those people who may have been exposed and are to quarantine at home aren't going to the hospital. So how do they get that referral?
So most individuals, and I might have Monica actually comment on this as well, if they're exposed and they're at home in that population, we'd like, as possible, for you to stay within your home setting. So if you are likely exposed to somebody through that route and you don't have somebody who's highly vulnerable in that setting, we'd like for you to remain there. So that would be that connection point would be once you have that positive person, identifying who that is and working through their healthcare provider to provide that housing solution. Monica, I might
Add a little bit to that. So I think the question being at the referral process and working with our healthcare providers, and the reason why we are focused on healthcare providers is also understanding the contact tracing of an individual. People that are asymptomatic about 48 hours prior to when their symptoms start actually are able to transmit the virus. So if they're already within their house setting, 48 hours, they've already exposed the people within their home. So those individuals are already going to be also under quarantine with them. And so for most individuals, if possible, we like you to self-isolate and quarantine in your own homes. The alternative housing plan are for those very specific individuals where that option does not become feasible. And then I think to add to another point about housing options, the state also has a statewide alternative housing plan. So if our capacity ever here locally were to reach a level where we have to refer outwards, we'd be referring then into the state's plan as well.
So how does that plan work? Would that be like referring people from here up to McCormick Place in Chicago, or how does that work?
So there's three, the question about the state's alternative housing plan right now, my understanding is there's 3 locations or regions identified, and so ours would be within the central region. That would be McCormick Place is an alternate care site. So it's actually for individuals that need medical attention, but not necessarily within the hospital setting. Here again, we are still not hitting our capacity needs or requirements in the hospital. So right now, the plan is really going to be focused on individuals that have been identified as vulnerable through Heartland Health Services and trying to move them out of the housing situation versus trying to take people from the hospital setting into 4 points right now.
Could you talk through some of the logistics of this? If you're saying, isolating people who may not have other place to isolate, how are you making sure they'll stay in that room? How are we making sure staff at the hotel stays safe? Can you talk through some of the logistics?
Sure. I think that's a big consideration that we have for everybody involved is just the safety and precautions that we need to take. Everything from food delivery that will be dropped off, each meal will be dropped off at the door. There will be a knock at the door and the person leaves. You come out, you pick up your food, you bring it into your room. So all of those little items that we can do to help minimize face-to-face interaction, we're taking those steps as we can. And it's been helpful that we have had several other communities across the country who've been a couple of weeks ahead of us in terms of planning. And so looking to some of those efforts in King County and Seattle and some of those other locations, they've kind of put together a quasi-playbook. And so referencing back to those and understanding how we can apply that here locally.
And then, so this is mainly specifically for our homeless populations, those in shelters. So this wouldn't include, say, a doctor who is afraid to go home because, you know, he or she could have been exposed and doesn't want to put their family at risk, or does that include them as well?
Right now, I believe that if they fall within those particular categories that we defined, that they would be included, but there are discussions about how could we potentially expand a housing option to include those individuals. So knowing that that's kind of a larger group and a larger pool, that certainly would exceed that 150 room capacity that we're looking at. What do we need to do additionally to meet those needs?
And then, any details on, you know, kind of where in the hotel this is? Is it like all on one or two floors? Just kind of, how is this separate from the rest of the hotel?
Concentration is important so that we can kind of reduce and eliminate some of those exposure points. And then again, having security on site to make sure that individuals are remaining in their rooms, because as much as we want to make this a positive experience for those who have to go through it, we also know that we have to be protective of individuals who are staying there, as well as those who are staff members who are there. And so making sure that we, again, are keeping people in their room rather than even wandering about a floor or to any of the communal areas.
And so then, you know, you talked about for those that may not have a primary, you know, care provider, that Heartland Health Services would be trying to help them out. Because if you could maybe, or you or Monica also, because when you're talking about these populations, these are people that, you know, unfortunately typically don't have a lot of access to healthcare every day and may not know that they're symptomatic or asymptomatic.
Right, so we do, we have kind of two paths in terms of for our individuals who are experiencing sheltered homelessness, so they're in our shelter programs. We do have very regular touch points where our providers are actually going on site. And again, that not only includes Heartland Health Services, but also Unity Point Health, as well as OSF, have been sending their caravans and their mobile units to these sites to do those evaluations, so that active monitoring is taking place. And then we also have a street outreach team that's focusing on our unsheltered homeless and making sure that they're remaining connected to resources, that they understand how to monitor and to get connected if they need to, because they start displaying those symptoms.
So they go on site, and that's how the homeless would get a referral to be in the 4 Points Hotel?
Yes.
And then how long is this anticipated to go? I mean, I know we don't know how long, you know, this whole shelter in place will take place, but kind of how long is the money how long does the money allot for? And then second part to that, kind of when it is all said and done, will some of that money go to the 4 Points to help them, you know, kind of deep sanitize, clean? I think, you know, the general public, you know, may not want to stay on a floor that they think was like the COVID unit kind of thing.
Yes, the costs that are associated with this particular model will be covered through the reimbursement process. So everything from security to food to laundry, all those things are covered within that reimbursement model with FEMA. And you had a second question and I already lost it.
Just how long kind of do we have planned out for this to go on?
I think it still is kind of an indefinite nature, but I will say in terms of the DHS funding that we received, that was kind of an initial pool of funds, and that extends through June 30th. So there's potential for additional funding to come down after that, but that's kind of the planning cycle that we've been working towards with the DHS funds.
And kind of just to piggyback off of her point, does 4 Points have any plan for after this is all over, like set a sanitizing plan, people knowing that COVID patients or people who had COVID-19 stay at this hotel may not want to stay? Have they thought about those repercussions?
Go ahead.
Answer that one.
Sure.
So the question is about individuals and possibly staying in a room that someone had COVID-19 in afterwards. I want to first begin by saying a big thanks to 4 Points for taking on this burden. I think it shows true leadership in a community that they are putting themselves in a position like this. And also needing to maybe also inform the public about viruses in general. COVID-19 is a droplet virus. It's no different than seasonal influenza in terms of a virus that you may have, even norovirus, which is a gastric one that people also have. So in terms of cleaning a space, they're going to be doing much more intensive cleaning, but if you go to a hotel and you're not concerned about getting norovirus, it's going to be similar in that aspect. So while 4 Points is doing their due diligence, the cleaning process of this is no different than any other virus that we are exposed to in day-to-day, basis, whether it is norovirus or influenza. So while I think there are concerns about, do I stay in another COVID-19 room? Again, it's going back to that focused idea of the fact that the virus is in our community. We've been exposed. Our homes have been exposed. Are we doing, what kind of deep clean are we doing in our own homes? As well as recognizing the fact that we have a community partner that stepped up and taken on a real leadership opportunity here and really leading by example. And so just a very much wanting to applaud 4 Points for taking on this role, not only for taking on maybe those concerns rather that the public have about a virus versus any other virus, but also recognizing the fact that they're putting their space into a situation that others would not. And so again, that just shows really good leadership from 4 Points.
I have a question for Scott.
Okay.
Fire away.
So the Peoria City Council is meeting tonight to talk about how much money it's losing and cuts that could possibly be made. Are there any worries at all that any cuts would curb our local response to the virus?
So, great question in terms of how cuts to the city budget specifically might curb our local response. I know that's something that the city council, the mayor, and the city manager are definitely looking at. It's something that we're looking at as it relates to Peoria County government. We're in a different situation than the city is. The hit to our revenues are going to be much less, and we've got greater fund balances than the city does, so we're going to be able to absorb some things. We are absolutely looking at what the impact of our expenditures are going to be, though, and what things we're going to have to curb from a service delivery standpoint to be able to manage the decrease in revenues that we'll see. What those look like right now is too early to tell, though. Anybody else? All right, thanks.
If there's no other questions, then we will see you guys. Oh, you do have more.
Did she say 150 rooms are available or 450?
150 rooms are available, yes. If there's no other questions, thank you guys, and we'll see you tomorrow.